You can look healthy, train hard, eat well, and still have a dangerous heart problem hiding quietly inside your body. That is the scary part. Some people can run, work out, play sports, and feel completely normal, while plaque is slowly building inside the arteries that supply blood to the heart. And because there may be no warning signs, the first sign of heart disease can sometimes be a serious heart attack. So how can someone who looks fit suddenly collapse? Let's break it down. Your heart is not just a muscle. It is a powerful pump that works every second of your life. To keep pumping, it needs a constant supply of oxygen-rich blood. That blood comes through special blood vessels called the coronary arteries. Think of them like small roads wrapped around the heart. If the road is clear, blood moves smoothly. But if that road becomes blocked, the heart muscle starts to suffer. One of the most important arteries is called the left anterior descending artery, also known as the LAD. Doctors sometimes call it the widowmaker because when this artery becomes badly blocked, it can affect a large part of the heart's main pumping chamber. But here is where many people misunderstand heart disease. A heart attack does not always happen because an artery slowly closes little by little until it finally shuts. Sometimes the artery can still look open enough for blood to pass through. You may feel fine. You may even exercise without symptoms. But inside the wall of that artery, plaque may be growing. Plaque is a mixture of cholesterol, calcium, fat, and inflammatory cells. Over time, things like high blood pressure, high blood sugar, smoking, poor diet, stress, genetics, and inflammation can damage the inside lining of the artery. When that lining gets injured, the body tries to repair it. Cholesterol and immune cells gather in that area, and slowly, plaque begins to form. The dangerous part is that the artery can stretch outward as plaque grows. So instead of the opening becoming narrow immediately, the artery adjusts. That means blood may still flow normally. This is why someone can have hidden heart disease and not know. No chest pain, no shortness of breath, no obvious warning. They may pass a normal day, go to the gym, run outside, or play sports and think everything is fine. But if that plaque becomes unstable, it can suddenly rupture. Imagine a small bump under the skin that suddenly bursts open. When plaque ruptures inside an artery, the body reacts like there is an injury. It sends platelets to the area to form a clot. That clot can grow very fast. In a few minutes, it can block the artery completely. When blood cannot reach part of the heart, that part of the heart starts dying. That is a heart attack. This is why heart disease can feel sudden, even though the process may have been building quietly for years. Another important thing to understand is that not every heart attack comes from a 100% blockage. Sometimes the problem is supply and demand. For example, someone may have a 40 or 50% blockage. While resting, the heart still gets enough blood. But during intense exercise, stress, dehydration, or a very fast heartbeat, the heart suddenly needs much more oxygen. If the artery cannot deliver enough blood to match that demand, the heart muscle becomes starved of oxygen. This can also cause damage. That is why symptoms during exercise should never be ignored. And the signs are not always the dramatic ones we see in movies. Yes, some people feel heavy chest pressure, pain going down the arm, or tightness in the chest. But others may feel unusual fatigue, dizziness, nausea, shortness of breath, sweating, jaw pain, back pain, or what feels like bad indigestion. Some people simply feel that something is wrong. That feeling should be taken seriously. The good news is that we are not completely helpless. Exercise is still one of the best things you can do for your heart. It helps improve blood pressure, blood sugar control, circulation, weight management, and overall heart strength. But exercise does not make you invisible to heart disease. Being fit lowers your risk, but it does not erase your risk. That is why knowing your numbers matters. You should know your blood pressure. You should know your cholesterol levels. You should know your blood sugar. You should know your family history. And if you have risk factors, a doctor may recommend further testing, such as a coronary calcium scan or other heart imaging, depending on your age, symptoms, and medical background. A calcium score can show hardened plaque in the arteries. Other scans can sometimes show narrowing or plaque that may not be picked up by basic blood work. This does not mean everyone should panic or run to get every scan available. It means you should not guess about your heart health. Looking healthy is not the same as being fully checked. Feeling fine is not always proof that everything is perfect. The real message is this: do not wait for chest pain before you care about your heart. Control your blood pressure. Manage your blood sugar. Avoid smoking. Stay active. Eat in a way that supports your heart. Sleep properly. Reduce stress where you can. And most importantly, speak with a healthcare professional if you have symptoms, risk factors, or a family history of heart disease. Because when it comes to the heart, early detection can save your life. Thank you for watching. Follow for more healthy tips.